I grew up with a birth defect where I was born missing 10 teeth. When I had baby teeth would get knocked out either, by playing sports in high school. There were no adult teeth to come in behind them, so I've had pretty large, substantial gaps in my upper and lower jaw for my entire life. Before my surgery, I don't even remember what it was like to chew on the right side because my teeth hadn't been functional on the right side of my mouth. Well, I grew up always hiding my teeth and not smiling very much, or lowering my upper lip to make sure that if I did make a smiling motion that my teeth didn't show. Now, I went to the dentist regularly, same dentist for over 20 years as an adult. One of the things that I really liked about Dr. Ayzin's office, it was so much more modern than the dentist that I had been seeing. Just from the multimedia, contacts via text, the reminders, just the way all the staff are very welcoming and friendly, it really exuded confidence in me.
John was an interesting case. He's a veteran, and he is used to just pushing through. John hadn't smiled in 30 years. He's learned to just keep on frowning or keep his mouth closed. On top of that, he couldn't chew on the right side, missing upper and lower teeth. Somehow he made it work.
I knew that implants was the way I was going to have to go. I was always concerned about having individual implants and how well those would match with the teeth that I still had in my mouth, and whether colors would match and how they would fit. So the complete replacement, this is the type of procedure that I thought was right for myself. I had an all-on-X upper replacement.
After what we did for John, he keeps telling me, I can't believe I'm smiling now. He almost looks awkward when he smiles because he can't believe he's smiling. It's an amazing thing to see. And the longer I've known John, the better and better his smile looks every day because he's learning again. And he looks great. And one of the coolest things that he told me about was once he cleared out the severe infection that was going on in his mouth, he sleeps better. He breathes better. He tells me the sinuses are cleared. His snoring is significantly less. I think he's a perfect example of how our dental health is connected to our overall health. And by fixing what was going on in his mouth, we're able to help and improve his life.
My expectations are far exceeded from what I even hoped to get out of this experience. Go see Dr. Ron and get an all-on-X. You will be happy.